So my name is Maev Conneely, and I'm going to give you a quick overview of this paper called Understanding Identity Changes in Psychosis, a Systematic Review and Narrative Synthesis. So a bit of background is that, so there's been a long history of interest in identity change in psychosis. This guy on the left or right for you is Eugen Bleuler, who is an early psychiatrist who coined the term schizophrenia and talked about schizophrenia in terms of this splitting of the personality. And other psychiatrists writing around then similarly saw a kind of change in identity as a key feature and a way of identifying schizophrenia. And you can still see this now in people who are talking about their experience of psychosis in first-person accounts or in qualitative research, where people say that there's a kind of change in their sense of self and that it can be quite distressing. So all of this is reflected in the recovery approach. So this CHIME acronym is part of defining what recovery is, which is looking like beyond symptoms only, in thinking about people becoming well, and identity is a part of that. So despite all of this kind of long history and current importance of identity, there's no clear way of understanding or a kind of a consensus on how to conceptualize identity change in psychosis, or to there's no kind of consensus on that. So that's what this review was trying to do. We were aiming to identify and synthesize research on identity changes in psychosis to create a conceptual framework to bring together all these different ways identity changes have been understood. So we registered our protocol and followed all of the Prisma guidelines of systematic reviews. And the analysis we did was a narrative synthesis. So there's a qualitative way of synthesizing evidence. And an important thing to note here is the people who were doing this research. So we had a multidisciplinary team that included people with experience in social psychology, in social psychiatry on the research side of things, and also clinical practice as psychiatrists, and also people who have experienced psychosis themselves. So they were able to bring that perspective to the analysis. So as well as bringing together the ways identity changes have been understood in the literature, we also, in the full paper, which you can find for free online, looked at how people who have experienced psychosis, the co-authors with lived experience, how the conceptual framework related to their experience. So they were able to reflect on which bits resonated and which bits didn't resonate so much with them. And so you can see there the end result is to have a network or plane of interlinked concepts that together provide a comprehensive understanding of a phenomenon. So without further ado, I will briefly tell you about the 5 ways we found in the psychosis literature that identity changes have been understood. So the first is the blue egg. So these are the kind of 5 overlapping conceptualizations, and the numbers in this figure are the papers in our review. So we found and included 59 papers, and some of them clearly defined identity change in one of the 5 conceptualizations in the final framework, and some of them kind of had more complex ways of describing their conceptualization of identity change, which kind of fit across different eggs in this conceptual framework. So the first one I'm going to talk about is the characteristics of psychosis way of understanding identity change. And this is very similar to how Eugen Bleuler talked about schizophrenia when it was first kind of coined as a term. So here identity changes are seen as part of the illness and as a way of identifying the illness, like another symptom like hallucinations or delusions, for example. And so identity change and illness are very closely interlinked here. They're kind of one and the same, basically. And so the way you might go about reducing distress linked to identity changes is very closely tied to overall symptom reduction. The second way of understanding identity changes is as a consequence of altered cognitive functioning. So basically there, identity change is seen as a kind of explained not just as a part of illness, but as a changed in ability to think about yourself and others, basically. And so here, this change in cognitive functioning might happen because of illness or because of antipsychotic treatment. But the key thing is that there's a kind of underlying ability that's no longer there or that's altered in some way. And so that is what is changing how people think about themselves and others. A more different way of understanding identity change is the yellow egg here, as a consequence of lost roles and relationships. And this is the most commonly found in the literature. Lots of different kind of ways of measuring this that broadly fit under this idea of lost roles being the reason that people's sense of self might change. And so the idea here is that you might experience a first episode of psychosis and then not be able to interact with the people that you usually do. So you might no longer be going to school and you might have been admitted to hospital. And that loss of those relationships and that role of, you know, being a student is seen as the reason that your sense of self might change. And then linked to that is the fourth way of understanding identity change was as a consequence of internalized stigma. And this, as you can see, has a big overlap with the lost roles and relationships understanding, because the two might kind of happen to coincide. If you're hospitalized and then not able to go to school anymore, and so don't see yourself as a student, you're also in hospital, which is a highly stigmatized place, often very unpleasant for people to be in as well. And you're getting a diagnosis of a severe mental illness, which is also a stigmatized thing. And so this way of understanding identity change was that people internalize that stigma that's out in the world, and that changes their sense of self. So those are the most common ways of understanding identity change. And the fifth one, the personal growth, was the least common, which is different to the others in that it's not tied to a kind of medicalized understanding of psychosis, and rather identity change is seen as something that is necessary and needed to happen and meaningful, although it might still be very distressing, and that it's kind of separate to symptoms. Like, it isn't necessarily that identity change happens as a consequence of illness, but it might happen even a bit before and then lead to the behaviors that then can be diagnosed as psychosis. So this is a kind of very quick overview of the conceptual framework of identity changes in psychosis. And it's a kind of a very complex picture, and we found lots of individual specific ways of thinking about identity change that were kind of synthesized into these 5 broad branches of the conceptual framework. So if you want to find out more, you can find the full paper by taking a photo of this or doing the QR code scanner thing. And yeah, you can find out more there. So I think that we might have some questions here. Let me see. So one of the questions here is, were there important differences in how the authors with lived experience understood identity changes in their lives and the understandings identified in the literature? So that's a really good question. Yeah, there were important differences. Basically, most of the understandings did resonate with the authors with lived experience, but some of them much less so than others. For example, a characteristic of psychosis wasn't a way that the co-authors who had experienced psychosis had thought about their experience of identity change. But for them, the one that resonated the most strongly was the personal growth understanding, which is interestingly like the least common in the literature at the moment. So I think that there's definitely space for more research to look at that way of understanding identity change. And I think another important point there is that we only looked at papers with at least a sample of 3 participants. So that excluded all first-person accounts of psychosis. And applying this framework to that type of text might yield different results, or we might have a different balance of the eggs. There might be kind of more of this understanding of identity change in a kind of personal growth context. And then the next question here is, what could the conceptual framework of identity changes in psychosis mean for clinical practice? I guess at the moment what we've done is just synthesize evidence from across the literature and bring it together in a way that we can kind of look across the different sort of approaches and kind of epistemologies, even ways of thinking about both the self and psychotic illness. But the main takeaway at the moment probably is that there are very different ways of understanding identity change, and individuals might experience and make sense of this in different ways at different points in their lives, and that's kind of okay. We don't have more evidence for one way of thinking about it, so none of these ways of thinking about identity change are wrong. And so I think having an open mind to whatever way their patients are thinking about their own experience would be good for clinicians.